I'm Carrie Schnocky. I am the CEO of the South Carolina Infant Mental Health Association. The name of our organization, South Carolina Infant Mental Health Association, doesn't really tell the whole story. Infant mental health only names the baby, but there's never really just a baby. An infant always exists in the context of a caregiving relationship with an adult. So infant mental health is really about supporting and healing relationships between caregivers and infants, because the health of those relationships have profound and long-lasting impact on a child's development. And that's why SCIMA exists. We have two lines of work. One line of work is largely focused on developing the workforce. That's those important professionals who engage with young children and their families. That could be child welfare, social workers, home visitors, early care and education teachers, pediatricians, mental health professionals. And then our other line of work is really direct service to families. So we have our Help Me Grow program that gives families free and easy access to developmental screening. And our Help Me Grow care coordinators help families find and connect to services in their community. And then we also have a handful of staff who are offering therapeutic services like child parent psychotherapy and others to families who have experienced trauma or are struggling with complicated life events that are really impacting the relational health of their family. A common misconception about infant mental health is that we are talking about, first of all, a baby in isolation. And often people are, because we have this bias in our country that when we say the words mental health, we mean disorder, problem, not health. So it can lead people to think of like, are we talking about like a baby on Freud's couch, or what's happening here? And that is not at all about it. Another way to talk about infant mental health is to talk about the relational health between the baby and their adult caregiver, because it is that context in which all other development is happening for the child, and it just has these most long-lasting effects on a human being through their entire life. Infant mental health work, it belongs to everyone. The mental health crisis that we're seeing in adolescents and adults that burdens our juvenile justice system, our schools, our judicial system, our prison systems, our drug substance use agencies. If we want to change that, we need to start prenatally to make sure that families have what they need to build strong children with the love and resilience that they need to navigate the challenges of the world they live in.